Hello, everyone, and welcome to Partners November Member Cafe. We're going to get started in just 1 second. Want to give a little bit more time for folks to join us, so we'll get started here shortly. Hello again, and welcome to Partners Member Cafe for November. I'm sure there'll be a few more folks joining us, but we'll go ahead and get started. We have a big agenda today, lots of speakers, great topic. So we want to go ahead and get started. I'm Cindy Trobaugh, and I'm part of the member engagement team here at Partners. And today, also joining us from Partners is Beth Brooks. She is our Zoom producer and knows all things Zoom behind the scenes and will keep us on track today and will help us to moderate questions at the end. Also, we have from member engagement, Kimberly Lambert, who will be putting things in the chat for you, resource information. You can cut and paste and save that information as you choose. Also joining us for member engagement is Ann Glove. She's part of our panel. You all wave and say hello to everybody. I'm going to go over some housekeeping first, and then we'll go ahead and introduce our speakers and get started. Today's topic is staying healthy as you age, and also honoring our tribal elders. We have several experts that will be joining us to share information with you and provide health resources and programs from everything from newborns, children's services, adult services, and also we'll be sharing information about aging population in our tribal community, as this month in November is Native American Heritage Month. So we're real excited about our topic today. Our session today is being offered in closed caption. So if this if you don't need this feature, you can simply hover over that at the bottom of the screen and choose to disable that. Also, it's going to be recorded today. So we offer this recording so that we can put it on our website and that you can watch it again later or share that link out with friends and family who have missed it. But because it's being recorded, we want to remind you not to share anything that's personal. If you need to speak with a member engagement staff member, we are here to help you and speak with you at some other time, but we just discourage you from putting anything personal out on the recording. So I want to also identify some Zoom features for you. So down on the bottom part of your screen, you should see some Zoom features. And so one of those is chat. We want to tell you that the chat is being disabled today. We will be chatting out important information to you today. Kimberly's going to be doing that for us. So there'll be links, phone numbers, websites, lots of good information for you put in the chat. If you have questions throughout the presentation, we encourage you to put that in the Q&A. And then after the presentations, we will be moderating those questions and getting to you there. You can also raise your hand and we will be able to call on you, take you off mute, and you can ask your question live at that time. So at this time, I'd like to introduce our speakers. We're just real excited to have them here with us today. So first, you'll hear from two speakers on our programs that we have across all age groups here at Partners for Physical Health Resources and Services and Programs. And when we get to Shelby a little later, I'll introduce her. So first of all, I want to introduce Dr. Leah Williams Pearsall. She has built an extensive career focusing on qualitative and quantitative research methods, program evaluation, behavior health, and health disparities. She brings over a decade of experience from academic institutions, research centers, state and local government agencies, and nonprofit public health. She serves as the Senior Director of Population Health here at Partners, and she has oversight over the transition of community living and housing, consumer rights, population health programs, data analytics and analysis, and the Substance Abuse and Mental Health Services Administration and the North Carolina Department of Health and Human Services grants. She leads population health initiatives focused on improving health outcomes, addressing social determinants of health, and achieving health equity. She received her Doctor of Public Health from the University of South Carolina, a master's in public health from the University of Kentucky, and a Bachelor of Arts in English from the University of North Carolina at Chapel Hill. Also joining her today is Dr. Jessica Hoyle, who is our Population Health Impact and Development Assistant Director here at Partners. She coordinates the Partners maternal wellness programs and has extensive clinical experience with individuals with intellectual and developmental disabilities. Her research centers on health disparities of adolescents and young adults with disabilities. I'll now turn it over to Dr. Pearsall and Dr. Hoyle to go ahead with their presentation. Thank you both.
Thank you so much. And we're ready for our first slide. Next slide. Thank you for that awesome introduction, Cindy. Again, my name is Leah Williams Pearsall. I'm really excited to be here. So our presentation today is titled Improving Overall Health. And I want to first say congratulations to all of you for joining this member cafe, taking the initiative to learn more about how you can improve your overall health. So congratulations on that, and thank you for joining. The purpose of this presentation today at Partners, we promote health and wellness for all of our members. So what myself and Dr. Hoyle would like to walk with you today is to discuss more about the initiatives, programs, and resources that we have here at Partners that can do just that, improve your overall health and wellness. Next slide, please. So at Partners, we believe that our members deserve the very best in care. To obtain the best care, we promote screenings, prevention, and wellness opportunities. One of the very best ways that you can get and stay healthy is to be connected with a primary care physician for your annual wellness visits, as well as when you're sick when needed. It's important to have that relationship and communication with your primary care provider. At Partners, we also encourage and promote compliance with medication, services, as well as care plans, because they're very important in optimizing your health. And care management also plays a vital role in living a healthy and active life. Next slide, please. So during our presentation today, we're going to walk through several initiatives that will improve your overall health. We're going to start with our opioid misuse prevention and treatment program, followed by our tobacco cessation program, pregnancy program, and our chronic condition management programs. Then we'll delve deeper into some of our child health initiatives. related to early and periodic screenings, diagnosis and treatment, otherwise known as EPSDT, immunizations, vaccines, and newborn screenings. And then we'll end with information about our Healthy Opportunities program, which relates to social determinant of health needs. Next slide. So let's just jump in and start first with our opioid misuse prevention and treatment program. It's a mouthful. But at Partners, we recognize that many individuals do benefit from opioid use. But we also recognize the importance of preventing the misuse of opioids. So we want to help prevent any type of complications or overdose deaths that can occur from the misuse of opioids. At Partners, we have a project called Project ROSE, and ROSE stands for Reducing Harm from Opioids. And this program supports individuals who would benefit from either reduction or better management in their opioid use. At the bottom of the screen here, you'll see we've included a link that will take you to more information about our opioid program. Next slide, please. Next, we'll shift to our tobacco cessation program. In alignment with our dedication to public health, we have our tobacco cessation program, which is designed to provide comprehensive support to our members who are interested in quitting tobacco use. So it's our top priority to assist our members in not only preventing health complications, but also reducing the risk of increased mortality associated with tobacco use. Next slide, please. So within our tobacco cessation program, we have an initiative called Living Tobacco Free. And the Living Tobacco Free initiative has 4 key components. The first being education, providing education to our members around the prevention of tobacco use, as well as the risks associated with tobacco use. So hopefully we can prevent individuals from even starting tobacco use. The second component is intervention, where there are personalized tobacco cessation interventions in collaboration with Quit for Life. So, and these interventions are tailored specific to the individual because we're not all the same. So they're tailored and unique to the individual. The third component is promotion. We will launch supportive health promotion campaigns in partnership with the American Cancer Society. These promotional campaigns give us an opportunity to engage and get the word out about Living Tobacco Free and the Quit for Life program. Our fourth key component of the program is community involvement. So at Partners, we definitely support the community approach or collective impact. So in partnering with other community organizations, businesses to join us in creating smoke-free environments so we can create an environment that's healthy for all of us. You'll see at the bottom of this slide, we also have some links and some phone numbers that will take you to more information about tobacco cessation program and the Living Tobacco Free initiative. Next slide, please. So now I'm going to shift gears a bit to our pregnancy program. So we are committed to supporting both the mental and physical health of our members who are pregnant. The care managers at Partners, we offer pregnant members resources and support to help each member effectively manage their pregnancy in a way that works for them, and emphasizing the section on in a way that works for them. Some of the resources and supports may include referrals to the local health department programs, pregnancy education, self-management tools, or referrals for social determinant of health support. If you want more information about pregnancy programs at Partners, you can email population health programs at partnersbhm.org or contact your care manager for more information. Next slide. So now I'm going to shift the presentation over to Dr. Hoyle to walk us through the rest of our presentation this afternoon. Thank you.
All right, thank you so much. So this next piece speaks to chronic conditions. So Partners believes that members with chronic conditions deserve the opportunity to achieve the highest level of wellness possible. We know that trying to manage a chronic condition can be difficult, as these are lifelong and often have effects that spill over into different parts of a person's life. So we are working on some chronic conditions programs that will address both diabetes and asthma. These programs will be time limited, and each member that participates in the program will work with a health coach. And this health coach will work with the member to set and reach goals that are important for that member's wellness. Next slide, please. So turning to child health, we know that children have a lot of great potential, and it's super important that we start our kids off in the best way possible. One of the ways that we do this is promoting newborn screenings. Newborn screenings help to identify conditions in newborns that could affect their long-term health. And it also helps us to arrange for and help coordinate early intervention as soon as possible. The early detection of these disorders before they become serious is a priority to wellness. We also encourage parents to talk with your child's medical provider about their immunizations and vaccines. There are vaccine schedules and recommendations that your provider can help you understand better. Vaccinating on time means that we have healthier children, families, and communities. Next slide, please. So if you are familiar with child health and Medicaid, you may be familiar with early and periodic screening, diagnosis, and treatment, also called EPSDT. EPSDT is a federal mandate that provides for periodic screening, vision, dental, and hearing services for children who are under 21 years old who are enrolled in a Medicaid plan. Members can access these periodic screenings and services that are medically necessary to treat, correct, or reduce illnesses and conditions, regardless of whether that service is covered in a state's plan. To learn more about these services, talk to your child's PCP, primary care physician, or care manager, and you'll see on the screen there, there's a link to more information about EPSDT services and what that means. Next, please. All right, now shifting over to the Healthy Opportunities Pilot. This is a program that is offered through Partners. It provides non-medical services that are not covered by Medicaid to eligible members. The goal is to address social needs to improve the health and well-being of our members, and is currently available in 2 of our counties. Within the Partners area, it is available to Burke and Rutherford counties, and then other counties in the state as well. So the eligibility criteria are listed there. The Healthy Opportunities Pilot does include services, including food support, meal delivery, non-emergency health-related transportation, housing services, legal assistance, etc. If you are interested in the Healthy Opportunities Pilot, you can ask your tailored care manager, provider, or call the Partners Access line. The number is there on the screen, and the email address for the HOP team is hop@partnersbhm.org, and there are additional links there on the screen for more information as well. Next, please. And just a reminder, you may be familiar with these call lines, but Partners does have a couple of call lines available to you. The first one listed there is the Partners Tailored Plan Nurse line. By calling this number, members can access a nurse who is available to speak to them 24 hours a day, 7 days a week. You can get answers to basic questions or concerns about your health, symptoms, or medications. If you have questions about your prescriptions, we also have the Partners Tailored Plan Pharmacy line, and the number is listed there on the screen. Next, please. All right, and this is a list of some additional health and wellness resources that you can find on the Partners Health and Wellness webpage. The link is there, and I believe it'll be put in the chat as well. Some of our health and wellness resources that are more self-directed that you can access on your own they include confidential online mental health and wellness tools, teledoc information, some self-help assessments, a link to our PICS Health mobile app, which is a wonderful resource for our members. PICS Health is targeted toward helping people who may be experiencing loneliness, and the PICS Health app offers both self-directed activities and the opportunity to chat with a real-life person that can offer some support if folks are feeling lonely or down. That's a great resource, so I encourage you to check that out. Like I said, those resources can be found at that link, and we also have the Partners Health Library, which contains articles and videos on a number of health topics. You access the health library, and you can search by topic or question that you may have about your health. So all of those are self-directed resources available to members on our website. Next, please. All right, and we also have self-assessment and education. Like I said, there's the Health Check 2020, which includes a depression screening and alcohol screening. We have other important self-assessments where you can fill out a questionnaire and get some suggestions related to some of the topics that are listed there. Next slide, please. And here is some additional contact information. Again, if you have questions about your annual wellness check, routine or sick care referrals for specialty care, the best person to contact there is your primary care physician. Your tailored care manager can help with coordination of care and linking you to resources. We have our member and recipient services line listed there, as well as the nurse line and pharmacy line that I mentioned. Any member questions can go to memberquestions@partnersbhm.org. The email address for our population health programs is there, as well as links for our prevention and population health programs and health and wellness information. And I believe that finishes up our part. So thank you so much. We appreciate you having us here.
Thank you, Drs. Pearsall and Hoyle, for your presentation. For the folks in the audience, I'm going to remind you to please put any questions that you may have so far in the Q&A. At the bottom of your screen, you'll see a Q&A box. It's got a little question mark in it. Just open that up, type in your question. We will get to those just shortly. Right now, I want to introduce our next speaker. With this month being Native American Heritage Month, we thought it was important to present on the aging population in our tribal community as well. Elder tribal members are held in high esteem in the Native American culture because they are the sacred keepers of history and traditional practices. So now it's my pleasure to introduce to you Shelby Holland, who is our tribal liaison with Partners. She holds a master's in social work and is a licensed clinical social worker. Shelby is a proud member of the Lumbee tribe here in North Carolina and works closely with the tribal leaders from 8 state recognized tribes to ensure their members' needs are met. So I'd like to introduce you to Shelby Holland. Thank you, Shelby.
Hi, everyone. Thank you so much, Cindy, and thank you, Member Engagement, for having me. Hello, everyone. Like Cindy said, my name is Shelby Holland, and I am the Tribal Liaison with Partners Health Management. I am a licensed clinical social worker, as well as a proud enrolled member of the Lumbee Tribe of North Carolina. And today, as Cindy stated, I will be presenting on the importance of honoring tribal elders. In my culture, we honor and prioritize three types of individuals, and they include women that are with child, members of the military, including veterans, and our elders. So let's go ahead and jump into it. What is a tribal elder? So before we get into it, I think it's super important to define what a tribal elder is because not everyone knows. So a tribal elder is someone who is above the age of 60 or 65. And this number will vary depending on the tribe. So out of our 574 federally recognized tribes, there are nearly 1 million American Indians and Alaska Natives that are over the age of 65. And when you take into consideration the state recognized tribes, this number is going to be even greater. So I did want to note that the pictures used in this slide have been approved for use by tribal leaders. I thought they were great additions to help show you what tribal elders look like and how they are represented at events. As you can see, the gentleman to the right is in front, followed by a younger tribal leader. That is very intentional, and I'll definitely get into that later on in this presentation. And then unlike in most cultures, the Native American culture believes in a patriarchy society. So, excuse me, a matriarchy society. So you will see the woman in the picture there to the left. She's watching intently, and it is her duty to oversee and make any corrections as she sees fit. Next slide, please. All right, why are tribal elders sacred? Cindy hit on this a little bit. Tribal elders are thought to be the backbone and heartbeat of our community. They are the keepers and guardians of our culture and traditions, which makes their roles extremely vital in regards to the continuance of my culture. What are community traditions? So community traditions are values and practices relating to religious and spiritual beliefs. In my culture, that would include natural medicines, dances, songs, etc. And all those are passed down orally through generations, which is why elders are so important, right? Another reason why elders are held in such high esteem is because they are expected to be included in all decision making in regards to their tribe. So anytime someone is at the table making a decision, tribal elders are thought to be at the head of that table and are expected to have their opinion weigh a little bit heavier. And lastly, in my culture, it's believed that the creator or higher power often communicates through tribal elders. So this means that in order, maybe 100 years ago, in order for us to survive, or nowadays, maybe make the right decision, we need to know what the creator wants us to do, which can only be done through our elders. Next slide. How do we honor tribal elders? So if you ever attend an event or have attended an event where Native Americans are present, you will often see younger people getting food or acquiring seats for their elders. We also do not dance before our elders at powwows. This is a sign of respect. Many elders are called to initiate the start of an event or program, which is why, to circle back to the previous slide, you saw the gentleman leading the younger tribal members because we allow our elders to start off all events. Another way we honor our elders is by being very attentive. Whenever an elder is speaking, individuals know to be quiet and to be very engaged. You'll often see people hanging on to every single word when an elder is speaking. That's a big difference in my culture. You know, like Thanksgiving is coming up and you're going to probably be around your grandparents, and your grandparents might tell you that same story they've told you 700 times. The difference is in Native American culture, we listen thoroughly and we ask the same questions we asked last time, and we soak up the moments as much as we can with them. Next slide. So what can non-native people do? If you find yourself working with or alongside of a tribal elder, it would be amazing to kind of keep in mind that elders prioritize traditional medicines such as holistic connectedness, harmony with nature, etc., rather than the traditional route of Western medicine. So, for example, understanding that spirituality is a priority and is an indispensable part of an elder's life. So they have to have the ability to practice and access spiritual resources. So be super mindful of their time. Also support their decisions in practicing traditional ceremonies, such as talking to a medicine man instead of maybe going to their doctor, or smudging, etc. There's a lot of traditional ceremonies that we feel are more healing than the traditional route. It's also super important to note that all practices and beliefs, they vary within tribes, so keeping that in mind as well. Next slide. Before we jump into this video, I did want to just let you guys know that this video was taking place in Cherokee, North Carolina, which is where North Carolina's only federal tribe is located, and they are called the Eastern Band of Cherokee Indians. This video is from 2023, and it was taken at the Elders Conference. Beth, if you want to go ahead and play that for me. Okay, while we're getting back to the slides, the PowerPoint, I thought it was super important to include that video just to show a little bit of the culture, and you can hear the traditional music and the singing. That was live singing. You can also hear the drums in the video. Drums are a sacred part of my culture. Only men can play them. And you can see some of the way our elders can participate in age-appropriate dances. I know it seemed pretty simple, but it's a way that those who are not as agile anymore are able to participate in dances and still celebrate. And if you notice the way they were dressed, they're dressed in the regalia of the culture. And it's just a way to center ourselves back into community. This last slide, I did want to read a spiritual prayer that was once given by an elder. It says, honor the sacred, honor the earth, our mother, honor the elders, honor all with whom we share the earth. Four-leggeds, two-leggeds, winged ones, swimmers, crawlers, plant and rock people, walk in balance and beauty. I thought this was important because you can see the elders are specifically mentioned here in this prayer, and that is done so as a reminder to all that without our elders we don't function or even exist at this point, right? Our elders that came before us did a lot of paving the way for us. And I have put my contact information on this slide. If you have any further questions or want any additional trainings, I do trainings year-round on the culture. You can absolutely reach out to me at any time. Thank you again, Member Engagement, for inviting me in a very special month.
Thank you, Shelby. Wonderful. And that was a beautiful prayer at the end there. I love that. Would like to move us into the question and answer time now. I believe we're going to be back in panel view, so you'll see all of our panel. And I would encourage you, I don't know that we have any questions yet, but please use our the Zoom feature at the bottom of your screen, the question and answer. Again, the chat's been disabled. We've been chatting important information out to you today, but please use the question and answer feature. It's the little box with the question mark in it to type in anything, or if you choose just to raise your hand, Beth will be able to see any hands raised from the participants in the audience today, and we can open your mic and you can ask it verbally instead of having to type it in. We welcome you to do that. And you can ask questions about any of the information that you've heard about today, about either presentation. And we have our experts here to answer your questions. Any hands raised at this time, Beth? And I don't see any questions. What we can do, we'll give it another second to see if there's any questions, but of course we have some additional partners information that we'd like to share with you today, and we can move forward with that while we're waiting for folks to put their questions in or raise their hand. Okay. Well, you've been hearing about this for a long time, but Tailored Plan is live. We launched moving into becoming a tailored plan on July 1st of this year. Partners is now a local management entity, a managed care organization that also manages 2 different health plans. Our tailored plan for folks who have more need or chronic conditions with behavioral health and healthcare. Your Medicaid has probably changed over to show that you have the tailored plan. We also manage the Medicaid Direct Health Plan as well. We also still serve folks who are uninsured or don't have the coverage that they need, maybe underinsured through limited state funding as well. So we can move on to the next slide. And this is what your tailored plan Medicaid ID card looks like now. It's changed a little bit. We hope that all the information is on there and accurate for you. We do encourage you, if you do see any information that you don't feel is correct, to reach out to us and we can assist you with that. On this card now, it will have information for you and lots of numbers. We're going to make sure you have all the numbers that you need. But on this Medicaid ID card, you will see the member and recipient services line. That's that first number on the back of your card, that 1-888-235-4673. That is one number that you'll want to have available, that you can reach most of any of the other numbers, because we can make sure if you call that number that we can get you to the right place, or there's a menu that you can select what other number that you need. So if you're a person that just needs one number to keep track of, that's the number you're going to want to make sure that you have, and it's right on the back of your ID card. Also, there's a connection for Partners Member Connect. That's our member portal, and we're going to go over some of these with some additional slides in just a minute. But the Member Connect is a portal on our website that you can register for, create a login, and we'll tell you more information that you can find there. But that's an important thing that we encourage you to do, is register for Member Connect and have access to that member portal. Also, you heard Jessica mention a few of our call lines right here on the back of your ID card. If you're a tailored plan member, you will see that 24-hour nurse advice line and the 24-hour crisis line numbers. We'll go over those in just a second. Also, on the front of the card and on the back of the card, there's that pharmacy number. So if you or your pharmacy needs to ask a question about your prescription, feel free to get in touch with that pharmacy line. Okay, let's move on to another. So this is a little bit at a glance here, all those numbers we've been talking about. We'll put these in the chat for you. We will also, if you'd like, you can contact us. We could get you all of these numbers. You could take a screenshot, would be a good idea, of this particular slide, because all the numbers are right here. So that member and recipient service line, that 888-235-4673. That's that one number that can help you get to all the rest of these numbers. That number is open from Monday to Saturday from 7 a.m. to 6 p.m. And that's for Medicaid members, state-funded recipients, stakeholders. Anybody really can call that number and get assistance. We do have a behavioral health crisis line. This is for folks who may feel like they need some additional support during a crisis time. And that number is available 24 hours a day, 7 days a week. And that's for anybody to call if you feel like you're having a crisis. That number is that 833-353-2093. Another important number is that non-emergency medical transportation. Now, this requires you to, if you're a tailored plan member, you would book your transportation through this number, 833-577-2309. They're available Monday through Saturday from 7 a.m. to 6 p.m. And that is, again, for tailored plan Medicaid members. So if you have Medicaid Direct, you would still book your non-emergency medical transportation, as you always have, through the Department of Social Services. But if you're a tailored plan member, you'll book it through this number here. They do require you to book several days in advance. I think 2 at the minimum, but you can book up, 30 days in advance of an appointment. So please call ahead and get those scheduled. That would take you to a doctor's appointment, a specialist, to the pharmacy to pick up meds. Excuse me. Again, the nurse advice line, if you have questions about anything that comes up that you have a medical question, you could call this nurse advice line, and that's 888-369-2452. Again, that's 24 hours a day, 7 days a week for our tailored plan members. The pharmacy services number, another one that's available 24 hours a day, 7 days a week for our tailored plan members. And that number is 866-453-7196. The Teladoc Health is fairly new, and we want to encourage you to call there if you need assistance or have medical questions or want to set up to use the Teladoc services. We do encourage you to register, because it does require you to register for this service. But if you register in advance, then you can call them at any time after that. If you call needing it right today, they're going to make you register first, so then you can use it. So go ahead and get registered to use the Teladoc Health. And that's 800-835-2362. And then also, sometimes we have providers on this call, but there's a provider services number for our providers, and that is 877-398-4145. And again, that's Monday through Saturday from 7 a.m. to 6 p.m. Jessica also told you about our Partners Health Library. So we want to encourage you to check it out. It's got lots of information to help you make good decisions. This is one that you can go to by yourself on our website. The link is there. We'll put it again in the chat for you, but it has all sorts of articles, tools, resources, information that you can read, videos, all sorts of information about any health condition that you're looking for. And we partner with HealthWise to bring this to you. And so it is updated regularly by industry experts. So any of the information that you go out there and find, it is up to date and current and relevant information for you. This is the Partners Connect that I told you about. When you go to our website, you will see in the upper right-hand corner, Member Connect. That's that member portal. And we would encourage you to go ahead and click into that and go ahead and register. You'll have to create a login and you'll need your Medicaid ID number to do that. On Member Connect, you will have information that's available to you. There'll be quick links. There will be information, documents in your health record, information about benefits and eligibility, mental health screenings that you can link to. You can link to those pages that were shared with you earlier about where to do all those health assessments and find information about the maternal health, the newborn information, all of those that you heard about today will be links from this page. And also there's going to be member resources. So this is a good place where you can find your member handbook or the rights and responsibilities or how to file a grievance or an appeal, much more. You can also do secure messaging to partner staff and get answers that way as well. And just lots of information. So go in there and check that out. So transitions of care, if you're in a health plan, you can switch between them for certain reasons. Members may move between health plans if you have a change in your service need or benefit plan need, or if you've changed county of residence, or if you have a change in your Medicaid status. But we have a team here at Partners who will help you with that process. But the quickest way to expedite a change between health plans would be to work with your provider, who could fill out a request to change form for you, and that will get the ball rolling a whole lot quicker. So we'll put that information in the chat for you. Also, you can activate this process by going through the North Carolina Medicaid enrollment broker, and we'll put the enrollment broker's website and phone number in the chat for you as well. So our team here at Partners, the member engagement team, is really here to help you with your needs. Of course, we would encourage you, if you do have a care manager, to speak with your care manager, because that is the one person would be your point of contact at Partners. If you don't have a care manager, or you just have general questions, you can reach out to member engagement and we will help you to navigate the system, advocate for you, and support whatever needs you might have and point you in the right direction. Our team's often on the phones and out in the community, so you'll see us out and about letting folks know about what we do here at Partners. Jessica also talked to you earlier and mentioned and put a plug in. Thank you very much for our Pix Health mobile app. I want to tell you that this app will help you to monitor your physical and mental health. It is a app that has lots of self-assessment tools and live compassionate call center where you can call and talk to a person. But we would encourage you to check it out as well. It does help with daily mood. It combats loneliness, depression, and anxiety. I've checked it out myself. It's got a lot of fun activities in there, very engaging. A little chat bot that will ask you questions or speak to you, or you can converse that way, or you can call the call center. This is an app that you can download to any mobile device, a phone or a laptop, iPad. And you can also use the phone number and call if you're not somebody who wants to do it on a mobile app. That compassionate call center is there for our members through the phone number as well, and you can call and talk to them. If you register, we want to let you know about a $10 gift card for those who register for this. So there's an incentive program built in. If you register, download it, begin to use it, you can get a $10 gift card. And I also want to take this opportunity to tell you about our another incentive that we have. There's a $20 great day reward just for doing something that you may do every year anyway. If you go and have that annual physical or that wellness visit, we call it different things, but when we say wellness visit, we mean that annual physical. So if you go and have your annual physical, you can, if you're a tailored plan member or a member of Partners, you can reach out to us and we will work with you to get that $20 Great Day gift card reward. So we want to encourage you to stay in touch with us. It's real important that you keep your contact information up to date. We work with the Department of Social Services. So if you have a new address or a new phone number or a new way that you would like to be contacted, we ask that you update that information with your Medicaid worker at the Department of Social Services, because they share that contact information with us. And that's what we go by, is the information that Medicaid has down for you. So if you've moved recently or got a new phone number, please let them know and they will update your information. If you are a recipient of state funded services, please let us know here at Partners and we will update your information in our system as well so that we can contact you if there's changes with the health plan or if we need to reach out to you in any way. Okay, so if you'd like to receive information from Partners, you can hover over this QR code with your phone, which is one way to do it. You can go to the link on our website and go to the subscribe button. And this way you will be signing up to receive information from Partners. And it gives you several options. You can just get member information, provider information, stakeholder information, or you can click all three and we will send you lots of information that way. So if you want to stay well connected, go ahead and subscribe and we'll get you on the mailing list, email list. Okay, so it's really important for you all to let us know how we're doing here with the Member Cafe. We encourage you to take the survey at the end. It'll pop up for you at the end. There's several different ways you can take our survey. You can hover your phone over this QR code on the screen again and do it that way, or you can go to this link that we'll put in the chat and you can copy and paste that and go to our survey. But please let us know how we're doing. If this information is helpful and beneficial for you all, and how we can hear from you about what topics that you'd be interested in and hearing in the future. We're always doing planning and selecting new topics, so we'd love your input on that. So be in touch with us about that. All right, so let me go back and see, do we have any questions that have come up?
We have a hand raised, so I am going to go ahead and allow this person to ask their question. And okay.
Osio, how are you?
Hello.
My name is Gabriel, a Smiling Rabbit, and my question is in regards to Native Indigenous people who have partners and Medicaid, how to be able to, and they're not associated with their tribe yet, but they want to figure out how to be able to do that and how we can be able to connect with Shelby in regards to helping us be able to connect to our tribe, our tribal affiliation, if that's possible. Because I know that in some of the hospitals, they ask if you're associated with a tribe and they'll connect you to like, I guess a liaison or something in the hospital, but I never was able to connect with anyone in my doctor's appointment area. So
Beth, I can take this one if you don't mind. Hi, Gabriella. Thank you so much for your question. I'm going to, well, my email's in the chat. If you want to, just shoot me a separate email. I can help you. There are a lot of organizations that, I don't know where your tribe is located, but if it is in North Carolina, I can help you get connected. If it's not in North Carolina, there are 4 urban organizations that support, 4 urban organizations that are throughout the entire state that help tribal members. So if you'll just reach out to me separately, I can definitely help plug you in wherever we can get you based on your specific situation.
okay, thank you. Appreciate
Yeah,
it.
of course.
While we're waiting on some other questions, I want to just do a reminder. I think Dr. Leah mentioned earlier about the Great American Smokeout, but that's this month. It's Thursday, November 21st, and no better time than on the Great American Smokeout to maybe if you've been thinking about stop smoking, that would be a great day to do it with a lot of people across the nation who give up smoking on the same day. So lots of programs available to help you with that. And of course, we've got some information again on our website about tobacco cessation. All right. Any other questions, Beth, that you've seen come in? Any other hands raised? Well, I'm going to go ahead and close us out today. I want to thank our panelists here and especially our guest speakers, Dr. Leah Williams-Pearsall, Dr. Jessica Hoyle, and Shelby Holland for joining us today and providing you all with such great resource information and just informative information. And also, I would like to mention that our monthly member cafe in December, want to remind you of that, to please come back. We'll send out information about that and hope that you will encourage others to attend. Bring a friend next time. We'd love to have more of our members to come, and so we encourage you to when you get the invite or the flyer, please pass it around to others. We'd love to encourage folks to attend. So want to just thank you again for your time today and spending it with us. And we want to wish you well, good health, and come back and see us next month, and have a great day. Thank you, everybody.